Hi, I'm David Liew from Melbourne, Australia, reporting again for Room Now here at ACR 2018 in Chicago. Just come from a very interesting abstract about yellow fever vaccination in Sao Paulo, Brazil, and I thought it might have some implications for my practice. A lot of my patients want to go to countries which are yellow fever endemic. They might be on immunomodulatory therapy at the time, and the question is always, do we have to, in order to yellow fever vaccinate these patients, because they might need that to come back, not just in terms of preventing the disease, but coming back into the country, should we withhold the immunomodulation or should we do something else? Should we continue it through? Well, we've had some very useful data from colleagues in Sao Paulo where they have a current yellow fever outbreak and they mandate a yellow fever vaccination. It's from Michelle Lopez, who is a rheumatologist there. She described the experience where they had 159 rheumatic disease patients who received yellow fever vaccination who were on what they called light immunomodulatory therapy. So that really constitutes conventional synthetic DMARDs, no biologics, but methotrexate up to 20, leflunomide up to 20, and that sort of thing, prednisolone up to 20 as well. Out of all those patients, the long and the short of it is that none of those patients ran into any serious problems. They compare them to some healthy controls, 159 matched healthy controls as well. They had similar rates of cytopenias. The cytopenias were fairly mild and recovered after 30 days. The adverse events were fairly mild as well. Some patients did get some side effects, but really those were short-term things. And most importantly, what we were really worried about, the viscerotropic disease, the reactivation-like disease that we might see from yellow fever vaccination, we didn't see any occurrences of that as well. So I think we probably do worry too much about our yellow fever vaccine and our rheumatic disease patients, and we're naturally cautious people. But at the same time, I think we can be reassured by these data that yellow fever vaccine is a safe option for our patients who are on conventional synthetic DMARDs. I'm David Liew, and go to roomnow.com for any further information. Thank you.